Students, good morning. I am Anja Varghese, lecturer of Emmanuel Asser College of Pharmacy. Today we are going to see about drug distribution systems in a hospital. What do you mean by drug distribution system in hospital? Definition: drug distribution is defined as physical transfer of drug from storage area in the hospital to the patient bedside. A drug distribution is defined as a physical transfer of drugs from storage area in the hospital to the patient bedside. Other definition. Other one, a drug distribution system in a hospital is the method by which medication are stored, prepared, dispensed, and delivered to patients in a safe, effective, and timely manner. Then, this involves two types of drug distribution: inpatient distribution and outpatient distribution. Then, drug distribution means drug distribution is defined as physical transfer of drugs from storage area in the hospital to the patient bedside. Okay, two types of distribution: inpatient distribution and outpatient distribution. Okay, the next slide we are seeing inpatient distribution. First one, inpatient distribution. The drug distribution to the patient department can be carried out from the outpatient dispensing area. The drug distribution to the in the patient department can be carried out from the outpatient dispensing area. Second, the pharmacist involved in the dispensing the drugs from outpatient can dispense drug for the patients too. The pharmacist employed for drug distribution to the patient's ward should be well skilled and qualified staff. This is inpatient distribution. The drug distribution to the patient department can be carried out from the outpatient dispensing area. The pharmacist employed for the drug distribution to the patient's ward should be well skilled and qualified staff. Then next point, outpatient distribution. What is outpatient distribution? Outpatient refer to the patients not occupying beds in hospital or in clinical health center and other places where outpatients usually go for healthcare. Outpatient refer to the patients not occupying beds in the hospital or other clinical health centers and other places where patients usually go for health care. The non-medicament should be issued without the prescription. No medicament should be issued without the prescription. After the issues has been made, the quantities supplied must be recorded. After the issue has been made, the quantity supplied must be recorded. In short, from the outpatient department was called as a outpatient distribution. OPD means outpatient distribution. In short form, the outpatient department was called OPD. OPD means outpatient distribution. Then next slide we are seeing about types of drug distribution system. Individual prescription order system, completed four stock system, combination of individual prescription and a floor stock system, unit dosage system and a non-floor stock system. Individual prescription order system, completed four-stroke system, combination of individual prescriptions and floor-stroke system, unit dosage system, non-floor-stroke system. Then first one, individual prescription order system. Individual prescription order system. It is a type of prescription system where the physician writes the prescription for individual patients who obtains the drug prescribed from any medical store or hospital dispensing by paying on charges. It is a type of prescription system where the physician writes the prescription for individual patient who obtain the drug prescribed from any medical store or hospital dispensing by paying on charges. This system is generally used by the small and or private hospitals because of the reduced manpower requirements and disponibility for individualized services. The system is generally used by the small and otherwise private hospital because of the reduced manpower requirements and individualized services. Then advantages of all medication orders pharmacists are directly reviewed by a pharmacist. All medication order pharmacists are directly reviewed by pharmacists. It provides closer relation among pharmacist, physician, nurse and the patients. It provides closer relation among pharmacist, physician, nurse and the patients. It provides closer control of inventory. It provides closer control of inventory. There is a advantages. Then disadvantages is a wrong errors, illegal writing of the physician. Wrong error, illegal writing of the physician. Physician may write high economic drugs in the prescription or cost effectively drugs. Cost effectively drugs. Prescription or cost selectively drugs. Physician may be writing a high economic drugs and prescription of drugs. Wrong error, illegal writing. Then next slide is a floor-stroke system. What do you mean by floor-stroke? Under this system, the drugs are given to the patients through the nursing stations and the pharmacy supplies from the drugstore of a hospital. Drugstore of a hospital. Under this system, the drugs are given to the patients through the nursing stations and the pharmacy supplier from the drugstore of a hospitals. Drugstore of a hospitals. Then the way of the floor-stroke distribution including two types. Charged floor-stroke drugs and non-charged. Charged floor-stroke drugs and non-charged floor. The way floor-stroke distributions including two types. Charged floor-strokes and non-charged floor-strokes. Then charged floor-stroke system means in this method medicines which are stocked in the nursing stations all the times and charged to the patients accounted after administration to them. Then the patients is charged for every single dose administered to him. Once the floor-stroke list is prepared, it is the responsibility of the hospital pharmacist to make the drug available. In this method, medicines which are stocked in the nursing stations all the times and charged to the patients account after the administrator to them. The patients is charged for every single dose administered to him. Once the floor-stroke list is prepared, it is the responsibilities of the hospital pharmacist to make the drugs available. Drugs available is a charge flow store system. And non-charge flow store system means the system includes the medicaments placed in the nursing stations that are used by all the patients on the floor. The system includes the medicaments placed in the nursing stations that are used by all the patients on the floor. There shall be no directed charge from the pharmacist accounted. There shall be no directed charge from the patients account. This is a non-charge flow system. Then next point is then four methods in the first one, individual prescription order system, completed flow store system, combination of individual prescription and flow store system, underdose system and non-flow stock systems. Then four types. Okay. Then next topic is methods of dispensing no charge flow stores. Drug basket method. This method is adapted where nurse verify the availability of medicines in all rooms as well as in the refrigerator and accordingly prepare a master list of the pharmacy. Nurse will demanded for delivery of the drug at the floor. When there is an empty container, the nurse take in the drug basket. Once the procedure is completed, the drug basket containing empty container and demanded for floor stock suppliers sent to the pharmacies. Then mobile dispensing unit means it consists of the specialty construction stainless steel trolley with the mounted on the bottom trails. Accordingly, to recommend patients get the medicines via using unit. Then method of dispensing non-charges products means the drug baskets method. This method is read where the nurses for the availability of medicines in all rooms as well as in the refrigerator and accordingly prepare a master list of the pharmacy. Nurse will demand from the deliverer of drug at the floor. When there is empty container, the nurse take it to the drug basket. Then once the procedure is completed in the drug basket containing empty container and demanded from the floor stock suppliers sent to the pharmacy. Then next one, mobile dispensing unit. It consists of the specialty constructed stainless steel trolley which mount the bottom trays. Accordingly to recommend patients get the medicines via and units. Then advantages and disadvantages. The drugs are readily available for administration, minimum return of drugs, reduced in patient prescription order, reduction in the number of pharmacy personnel required. The drugs are readily available for administration, minimum return of drugs, reduced in patient prescription order, reduction in number of pharmacy personnel required. Then disadvantages. Then increase in change of medication error, increase in drug inventory, increase in changes of drug deterioration due to the lack of proper storage faculties and due to unaided drug degradation, increased workload on the nurse. Advantages. First of all, the drugs are already available for administration, minimum return of drugs, reduced in patient prescription orders, reduction in number of pharmacy personnel required. Disadvantage. Increasing in change of medication error, increase in drug inventory, increase in change of drug deterrence due to lack of proper storage due to the drug deteriorations, increased workload on the nurse. Then combination of individual prescriptions and follow stock systems. This system is followed by all government hospitals and also private hospital whose run on the basic of non-profit and no loss. The system is followed by all government hospitals and also private hospitals. Those run on the basic of non-profit and no loss. Surgical items are given to the patients who purchase and deposit those items in a hospital ward or rooms under the supervision of registered head nurse. Surgical items are given to the patients who purchase and deposit whose items in the hospital ward or room under the supervision of the registered head nurse. That is a combination of individual prescriptions and follow stop system. Next topic is unit dosage system. What do you mean by unit dosage form? Those medication ordered, stored, packed, handled, administered, and charged in multiples of single dosage units containing a predetermined amount of a drug or supply sufficient for one regular dose. Whose medication order, stored, packed, handled, administered and charged in a multiples of single dose unit containing a predetermined amount of a drug or supply sufficient for one regular dose. A single unit package is owned where containing one completed pharmaceutical dosage form. A single unit package is one which containing one completed pharmaceutical dosage. Example, one tablet or one capsules. One tablet or one capsules. Then, two methods of dispensing unit dosage area. Centralized unit dosage drug distribution systems and decentralized unit dosage distribution system. CUDD and DUDD. Centralized and decentralized. Two methods of unit dosage area. The unit dosage system means those medication ordered, stored, packed, handled, administered and charges in multiples of the single dose unit containing predetermined amount of a drug or supply sufficient for the regular dose. A single unit package is one which containing one completed pharmaceutical dosage. For example, one tablet or one capsules. Two types centralized unit dosage drug distribution system and decentralized unit dosage drug distribution systems. The centralized unit dosage form. In this system, all the drugs are stored in a central area of the pharmacy and the drugs are dispensed. To all inpatients in unit dose to operate the delivery system effectively various medications. Cards are used to transport a unit dosage is a patient sent to the forward copy to the physician. Original medication ordered to the pharmacy for the direct explanation and fillings. Central unit dosage form system means in this system all the drugs are stored in a central area of pharmacy and the drugs are dispensed to all inpatients in unit dose. To all inpatients in unit dose. To operate the delivery system effectively various medication. Charts are used to transport unit dosage to the patients and to forward a copy of the physician. Original medications ordered to the pharmacy for the direct explanations and filling. Then decentralized unit dosage forms. Unlike the centralized system, decentralized unit dosage system function through small select pharmacies which are located on each floor of the hospital. Unlike the centralized system, decentralized unit dosage system functions through small selective pharmacies which are located on each floor of the hospitals. In this system, the core pharmacy becomes a procurement, manufacturing, storage, and packing center which provides all medicines to all the licensed pharmacists. Then advantages: better financial control. It prevents loss of particularly used medications, does not require storage facilities and nursing stations. Better financial control. It prevents loss of particularly used medication, does not require storage facilities at nursing stations. Disadvantages: irregular dosage. Skilled physician is required for administration of drugs. Regular monitoring is required. Regular monitoring is required. Irregular dosage. Skilled physician is required for administration of drugs. Regular monitoring is required. Next, distribution of advantages. Then objectives of the drug distribution system in hospital: ensure right drugs, right dose, right patients, right time, and right route. Then minimizing medication error, improve patient safely, maintain drug control and inventory, then provide cost-effective therapy. The next, distribution of drugs to ICU, ICCU, NICU and emergency ward. Then first one, ICU, intensive care units. ICU means intensive care units, catered to patients with severe or life-threatening illness and injuries which require constant care, close supervision from life support equipment and medication in order to ensure normal bodily functions. That is a ICU. In close supervision from life support equipments and medication in order to ensure normal body functions. That is a ICU. The next one, ICC, intensive coronary care unit. What do you mean by ICCU? ICCU is a hospital ward specialized in the care of the patients with the heart attack, heart arrhythmia and various other heart conditions that require continuous monitoring and treatment. This is a hospital ward specialized in the care of the patients with heart attack and other various of the cardiac conditions that require continuous monitoring and treatment. That is a ICCU. The next one, NICU. NICU specializing in the care of premature newborn infants. The NICU is divided into several areas, including a critical care area for babies who require close monitoring and interventions, and intermediate care area for infants who are stable but will require specialized care. The next one is an emergency ward. Emergency ward is a medical treatment faculty specializing in emergency medicines, the acute care of patients who present without proper approachment either by their own means or by that one ambulance. The drug distributed to this department are packed in a single unit container and location are fixed of storage of 7 solutions. And pictures about automated drug dispensing systems. Automated dispensing is a pharmacy practice in which are devices to dispense medications and fill prescriptions. ADCs which can handle many determined medications are available in the number of the manufacturing such as a BD and HSL measles. That is a BD demonstrations automated dispensing system. Automated dispensing systems. It is a ADSM. Automated drug dispensing AR aluminum. Automatically dispensing omni cells for dispensing of controlled substance. Then distributions of narcotic and psychotropic substance and their storage. Distributions of the narcotic and psychotropic substance and their storages. Classification of drugs. Narcotic: opium, morphine and hasbulin. Depressants: barbiturates and tranquilizers. Stimulants: amphetamine and cocaine. Hallucinogens: LSD, careless stimulants. Then dispensing of controlled drugs. A separated register is maintained for controlled drugs. Various steps involve the following: medical superintendents in over to responsible for handling of controlled drugs, chief pharmacist procedure, store and responsible for proper dispensing of the drugs within the hospitals. Record information: full name of the patients, address, date, name and strength of the drugs, quantity of the drugs, signature of the prescriber, dose and routine of administrations. Full name of the patient, address, date, name and strength of the drug, quantity of drug, signature of the prescriber, dose and route of administrations. Then first one we are going to see about the three. First one is what do you mean by the drug distribution system in the hospitals? A drug distribution system in a hospital in this method by which medications are stored, prepared, dispensed by a delivered to patients in a safe, effectively and timely manner. Drug distribution is a defined physical transfer of drug from storage area in the hospital to the patients in a bedside. Objectives: ensure right drug, right dose, right patient, right time, right route. Then minimizing medication error. Improve patient safety. Maintain the drug control and inventory. Provide cost-effectively therapy. Then two types of distribution: inpatient distribution and outpatient distributions. The types of individual prescription order, completed order, combination of order, unit dosage of form, non-flow stock systems. Four types. Five types: individual prescriptions order system, completed four-star system, combination of individual prescriptions and flow system, unit dosage systems, and non-flow store systems. Then individual prescription order system strength advantages: all medications ordered pharmacists are directly reviewed by the pharmacist. Disadvantage: wrong errors, illegal writings of the prescriptions. Then that is a drug distribution system in the hospital. A drug distribution system in a hospital is this method by which medications are stored, prepared, dispensing by the divided to a patients in safely, effectively and timely manner. Then flow store systems are the two types: charge flow stores and non-clinical flow stores. This is flow stores used in the positions. Then last one say emergency. This sort of emergency and airflow, automated drug distributions, automated drug dispensing, emission dispensing area, controlled distribution of narcotic drug classification, dispensing and controlled drugs. Record information: full name of the patients, address, date, name and strength of the drugs, quantity of drugs, signature of the prescriber, dose and route of administration. Thank you.